Welcome back. Now our focus is on Nigeria's healthcare delivery system. Nigeria's health sector is plagued by multiple challenges: policy disconnections, inadequate capital spending, poor pay, outdated technologies, poor infrastructure, sharp disparities in the availability of medical facilities across the country, coupled with the severe political and economic stresses of the past years. And the net effect is inadequate medical supplies, drugs, equipment, and personnel. And the primary health care system has been described as the bedrock of health services. But in Nigeria, it would seem that this level of care in most parts of the country only exists in name. So how did we get to where we are? We'll try to find out how we can get to exactly where we should be in terms of the health sector. And we have in the studio here the president of the Association of Medical Officers of Health in Nigeria, Dr. Dusu Yaya. Thank you for being here.
Thank you.
Also, we have the chairman, Association of General and Private Medical Practitioners of Nigeria, Lagos State Chapter, who is also a specialist family physician, Dr. Adeyeye Arigbabuwo. Thank you for being here.
Good morning.
And in our Abuja studio, we'll be joined by the Executive Director, National Primary Healthcare Development Agency, Dr. Ado Mohammed. Thank you also for being here.
Good morning, Nigerians.
Okay, let me just start with you, Dr. Ado, while we are still in Abuja. How did we get to where we are concerning the Nigeria's healthcare system?
Let me start by first appreciating you and Channel Television for inviting me this morning to share with you the agenda of the Honorable Minister of Health, which is about revitalizing primary care in Nigeria. We need to understand the historical trend in terms of where we are and then where we are now. Over the years, our health system, particularly at primary care level, has been characterized by very inadequate service delivery, which is as a result of the fact that the infrastructure is in a very bad state, or even if the infrastructure is there, you have challenges of human resources, and then you also have challenges of commodities, and that results into suboptimal performance, particularly when it comes to getting value for money in terms of our investments. So what we are trying to do now is to change the narrative, in such a way that the health sector, particularly primary care, will be viewed not as an expenditure, but as an investment, where people will walk into a health center and then they get value for money. Because we need to also change the narrative, where we'll be speaking of healthcare as in terms of shared vision, healthcare in terms of shared prosperity, healthcare in terms of contributing to the socio-economic outcome of the country. And that is where we want to be. And that is why the Honorable Minister of Health has conceived the primary care under one roof, and then is also has conceived the idea of driving Nigeria towards universal health coverage. And that is a journey that we intend to undertake. And we're talking to the states and local government. Let's also understand the fact that when you come to architecture in terms of responsibility for primary care in this country, it's that of the state and local government. What the federal government does is to provide leadership, to also provide policy direction, and then to also monitor and track implementation. You realize that the most important component of healthcare delivery in this country, which is primary care, which is also the bedrock of our health system, is saddled to the local government, is assigned to local government. And we all know the challenges that local government have in terms of capacity, in terms of resource availability, and in terms of commitment. So the federal government is coming in to really see how we can address those challenges. And that is why we conceived the PAC under one roof in such a way that while the local government will continue to be responsible for PAC implementation, then we'll be able to go around in terms of making sure that we address some of those challenges. We believe that with the new agenda of PAC revitalization, which the Honourable Minister felt is driving, that within the next 3 to 4 years, we'll be able to effectively reposition primary care in the country in such a way that Nigerians can walk into any health center and then get quality care without suffering from huge out-of-pocket expenditure that has over the years characterized our health system. It's a journey that we've embarked on, and we're about to commence, and we believe that that will address the inadequacy that the system has witnessed. It's not as if over the years attempts have not been made to address these challenges. Of course, we recall the very good effort made by Professor Ransom Kuti in the 80s to reposition primary care in this country. That came with a lot of results, but unfortunately, it was not sustained after, because just as the Honourable Minister always say, is that you have a pyramid, on with the base being the apex, instead of the base being the primary care. So
okay,
we have a pyramid in the country where the first contact with the health system, with the health system is a tertiary institution.
Dr. Mohammed, let me come in here.
So
still stay with you in Abuja. Yes, the statements by the health minister, laudable statements, beautiful plan, but a lot of people would argue with you that this sounds like the normal rhetorics. This is not the first time this has gone on and on. The fact that we have a pyramid that is turned upside down has been there. A lot of people have talked about it. Different administrations have talked about it. I mean, how would that change anything when you say we need to change the narrative, but on ground, nothing happened?
This time around is very different, and we are very optimistic that this time around it will work, because what has been happening over the years is that the focus has just been on primary care. What really happened